Hi, my name is Shelby Nelson, and I'm the Director of Clinical Quality at Essential Speech and ABA Therapy. And I am a board certified behavior analyst, or BCBA, and I practice ABA, which is Applied Behavior Analysis. We love our acronyms in this field. So what is ABA? What I tell people is ABA is a scientific way of teaching. We have a lot of tools in our toolkit like reinforcement and differential reinforcement and prompting and priming and prompt fading, visuals, the list goes on, right? And if you've been in the field for any amount of time, you probably know that there's a whole language that comes with this field and with this service. Typically, when ABA is utilized for individuals on the autism spectrum, we are looking at building skills and working on skills that specifically target reduction in other behaviors. So if an individual engages in something like aggression or tantruming, we look at how can we teach a skill that's going to help them get their wants and needs in a more functional way, in a way that's safer, in a way that is more successful for that individual. So for example, if when you drive to the grocery store and you typically take a specific route, and instead today you had to go a different route because of construction and that has upset your child, ABA utilizes different strategies to support the individual in that moment and teach them long-term skills like coping strategies, self-advocacy, and we also help teach you how to support your child in those moments via family guidance meetings, which we ideally have once a month when you come in and observe what your child is doing at ABA and you practice some of those strategies as well. We'd love to see you more than once a month, but once a month is our minimum. ABA is utilized in many facets of our lives, not necessarily just with individuals on the autism spectrum. If you think about when we go to the grocery store, for example, there are environmental arrangements set up to prompt us to walk a certain way around that grocery store, right? The goal being that we buy more things, right? So if we walk around the perimeter of the store, which most people do, that's largely because of the environmental arrangements that has been set up and standardized for optimal sales. Science is ultimately the same thing that we utilize. We arrange the environment in such a way that an individual might be more or less likely to engage in a behavior, and then we reinforce those desirable behaviors and redirect the behaviors that are not adaptive and not supportive in order to teach the individual how to engage in behaviors that are more appropriate. At Essential Speech and ABA, when you are bringing your child in for ABA therapy, we initially start that therapy with an assessment. So a BCBA would join your child, conduct an assessment with them and with you. They would read through their diagnostic report just to really understand what's going on and what areas that we need to support them better in, and what areas they're going to need the most support in. After that assessment, your BCBA will submit a treatment plan to insurance based on their clinical recommendations, and then insurance will either deny or approve that. We will go through whatever process we need to get your child services, and then ABA therapy starts. ABA therapy is typically implemented by someone called a behavior technician. There are behavior technicians, and then there are also registered behavior technicians. At Essential Speech and ABA Therapy, we always register our behavior technicians. We provide them with training and competencies that are in line with our board certification to ensure that we are giving you the best treatment possible, that we are providing your child with the best treatment possible. Some behaviors you might see change when your child starts ABA therapy are increased communication and more appropriate social approaches to their peers, playing with peers better, hopefully tolerating some of those situations that have evoked some distress and some of those interfering behaviors like aggression or tantrum in the past. More self-advocacy, so kids that are asking for their wants and needs, whether that's through sign or PECS or AAC or vocally. And we consult with our SLPs, our speech language pathologists in-house, to know for sure which route we should take to help support your child communicate and engage in language more efficiently and effectively.
Thank you, Shelby, for that valuable information and introduction to ABA therapy. My name's Nafisa Obi, and I'm the co-founder of Essential Speech and ABA Therapy and a speech language pathologist, or SLP. I'm so excited to share with you the crucial role that speech therapy plays in the development of children with autism. Speech therapy focuses on treating and diagnosing disorders with communication. And those disorders can range from language, receptive and expressive language, articulation, voice, and even swallowing disorders. Our general goal for children with autism is to enhance their ability to express themselves, to express their wants and needs to others, and also to understand the world around them. We want for them to be able to socialize with others and use communication as a powerful tool in which they're able to access their world. To enhance language development, we use a variety of tools, from PECS or Picture Exchange Communication Systems to AAC or Augmentative Alternative Communication Devices. We really want to use what works best for each individual child in order for them to access their voice. There's frequently a misunderstanding that the only means that a child can communicate is through their words, and ultimately that is our goal for most of our kids. However, we want for them to be able to communicate in a way that best suits them. So if that's through pictures, then that's what we'll use. If that's through a device, a high-tech device such as an iPad with a specific app that they use to communicate, then we'll use that. But we meet each child exactly where they are at in order for them to communicate in a way that's most meaningful for them. For example, a child might use an AAC device to communicate their favorite toy or request their favorite food or to tell you that they're hurt. They might also use it to just have a social interaction and take turns interacting with a peer. Our ultimate goal in speech therapy, especially for children on the autism spectrum, is to improve their ability to interact, which overall can just enhance their quality of life. At Essential Speech and ABA Therapy, we believe that it takes a village, it takes an entire team in order to help each child reach their maximum potential. And parents and caregivers are a huge part of that team. And so we really want to empower and motivate and teach each parent and caregiver how to best communicate with their child, how to allow for their child to access communication when they're at home or when they're in the grocery store, not just when they're within our clinic. So in order to facilitate this, we teach parents how to use visuals, how to model language, and how to really give the child time in order to communicate their wants and needs. That's one of the things that we often see with parents, is that they're so eager for their child to communicate that they really don't give their child that waiting period or that time for them to actually make a communicative attempt. Speech therapists do more than just address language skills. We also address articulation, or the way that a child is pronouncing their words. We address voice. We work with swallowing or feeding difficulties. And we also can just work with social interaction. So understanding cues, understanding social exchanges, knowing what's appropriate and what's inappropriate based on a social environment. At Essential Speech and ABA Therapy, the process of receiving speech therapy services starts with the assessment. So we gather information about the child's needs, about their challenges, about their strengths through standardized testing. We also interview parents or teachers and caregivers, and we observe the child to see how they're currently communicating. From there, we create an individualized treatment plan tailored specifically to each individual child. Once the plan is developed, we submit that to insurance for approval, just to maximize the coverage of therapy that that child is receiving. And once approved, therapy sessions begin. We start to monitor the child's progress towards those specific goals and adjust the type of cues or support that we're providing in order for that child to reach those goals. At Essential Speech and ABA Therapy, we believe in collaboration. So our speech therapists work closely with the RBTs or BCBAs who are working on the ABA side, and we also work closely with our occupational therapists just to ensure that we are providing holistic care to really maximize the progress that each child can potentially make. This teamwork ensures that the communication goals that we are addressing in speech therapy can generalize during other times of the day while they're participating in natural environment training with their BCBA, or when they're sitting at the table for table time with their RBT. Thank you for joining me today for a brief overview of speech therapy. I hope that this was informative and helpful. For more information about Essential Speech and ABA Therapy and what we do, please check out our website, our blog, and our social media. Thank you so much.